So, Laser 101. Let's take a beach walk. I've gotten lots of questions this week about lasers. I just posted a result of somebody that involved laser as an aspect of the treatment. And I think it warrants unpacking because we talk a lot about lasers, but maybe skip over some of the fundamentals. And so people don't really understand what they're doing or what they're getting. Um, so laser basics. There's kind of two different kinds of lasers. There's ablative lasers, which means they take the surface off of the skin. They sand that skin down to new baby skin and let your body regrow fresh, healthy collagen and skin in the place. That's an ablative laser. Non-ablative lasers are ones that target things deeper to the skin. They do nothing for the surface layer or minimal for the surface layer, but they'll target blood vessels or pigment deeper. Those lasers are very powerful and have a place. Intense pulse light or BBL, broadband light lasers, those lasers target deep to the surface. They're non-ablative. Similarly, vascular lasers, which target redness and spots. Great lasers, they do nothing for the surface. And then fractional versus non-fractional. So you have an ablative laser that does something to the surface of the skin. A fully ablative laser takes off the whole surface of the skin, completely sands everything down to new skin. That's great. That has a little bit more downtime. There's a little bit more involved, and the deeper you go with that, the more risk there is. So the companies came up with something called a fractional laser, which just pokes little holes essentially in the surface of the skin, where there's only small spots that are taken down to that depth that you desire to go to get a rejuvenation. Fractional lasers don't create as much damage. They don't get as big of a result. And in general, lasers, fortunately or unfortunately, the more pain you have, the more gain you get. So a laser treatment that has minimal to no downtime probably isn't going to have a super striking result. Now, there's nothing wrong with that, and sometimes you stack multiple treatments with minimal to no downtime, and you're able to eventually even get similar to what one of the more aggressive lasers has just by doing multiple smaller treatments. But yes, it's important to distinguish between lasers that fully ablate and lasers that are fractional. And then the third thing is what type of laser they are. For ablative lasers or lasers that take off the surface, there's really two main kinds. There's CO2 and there's erbium. The differences between them are probably at the level that we argue about at meetings, but CO2 lasers were first. They target water a little bit better. They're a lot hotter. They intrinsically cause more damage. And so you can't maybe sometimes go as deep with a CO2 laser due to issues with the heat. Whereas on the flip side, the erbium laser is cooler. It doesn't create as much damage. And so they have to add heat back in on the other side using another method to get the same result as you would with a CO2. But what it all comes down to is all the laser companies now have pretty much gotten to the point, whether it's erbium or CO2, the technology is there to get you an awesome result by fine-tuning those lasers. So CO2 in itself really doesn't mean anything about the treatment you're getting. The only thing that really matters for the treatment you're getting is who's doing that treatment, and do they know what they're doing, and what kind of treatment are they giving you. You can definitely hurt people with laser. I mean, it is something that burns the surface of the skin to a certain depth, and if you aren't aware of how to handle the laser, if you're going over the same area too often, if you're not maintaining your laser and you don't know how deep it is going, you definitely can cause injury. So yes, lasers are available at every corner, but it's very important that you go to somebody who knows what they're doing and does a lot of them, and you've seen the results from that place. The laser I use in my practice is an erbium. It's a Cyton fully ablative erbium laser. And I love that as a surgical laser because I have a lot of control down to the micron in how deep I'm getting in that skin. So the level of rejuvenation I'm getting and also the level of wrinkle I'm getting out, because the deeper the wrinkle you have, the deeper you're going to have to go to get that out. So I feel like I have the most control with the resurfacing laser I have. And I also feel like with erbium, I don't see as many issues in terms of hyperpigmentation or skin issues. When you expose the skin to heat from a laser, the skin reacts, and sometimes the melanocytes make weird pigment changes, and sometimes you get a lot of blood vessel growth that creates redness that can persist for a long time after laser. And I feel like I get less of that using the erbium laser, and that's why I have that as my choice laser rather than a CO2. But laser is an awesome treatment. There's so many modalities that can be used together to get you the result you want. And I think it's important to note that there is no one laser treatment that's ever going to take care of everything. You can't come in never having had a laser treatment and say, oh, I'm going to get my face lasered and I'm going to get my skin back to how it was 30 years ago. Laser is something you got to keep up with, continually doing it. I usually get at least one halo and maybe 1 to 2 broadband light treatments a year, and I'm 40. So this is something you need to keep up with over time to never let your skin get to the point where there's a lot of deep damage or etched lines that aren't going to come off with a laser treatment. So uh, that's my 2 cents on laser. Thank you for coming on this beach walk with me. I appreciate it. If you have any other topics you'd like to hear me talk about, please leave them below. Thanks.